Hello and good evening, good day to everyone from wherever you are, of course. And I'm very glad that we are back here once again. And welcome to our IVF webinars. And tonight we will have another interesting presentation and we will talk about IVF legislation once again, but this time we will focus on North Cyprus. And as you can see, we do have another special guest, and this is Özgü Özün, and he's the managing director at Dünya Clinic, which is located in North Cyprus. I'm very, very happy that you are with us. Finally, I had a chance to cooperate with Özgü before, and I'm glad that finally you were able to join us tonight, and you will talk about this interesting topic indeed. And of course, welcome on board. And how are you feeling? How are you today?
Yeah, great. Actually, it's been a nice day. It's been pretty hot. We have a heat wave, so summer is definitely on in Cyprus, but everything's going well.
That's great to hear. And thank you so much again for agreeing to present this topic. And before we start with the presentation, let me just mention that, as you probably know, My IVF Fences, we are part of European Fertility Society, and we are here every single day to provide you with IVF webinars, to provide you with some fertility experts, but as you know, also coaches. We have talked about different topics. This week we are focusing on IVF legislation in various countries, and I'm very proud to be a part of this team. And thank you so much everyone for joining us every single day. I know that some of you come here actually every single day, and it's amazing to see that it's helping, I guess. And of course, remember that after Özgü's presentation, we'll be having a Q&A session. So all you need to do is just type the questions in the chat section, and then of course Özgü will definitely help you out with those. So don't hesitate. Anything that's on your mind, anything that you would like to ask and find out about IVF legislation in North Cyprus, go ahead and do it. Of course, you can do it during the presentation afterwards as well. And I guess that will be it from me at this point. Özgü, let's get going with your presentation then, okay?
Yeah, sure. Thank you very much, Caroline, for this opportunity to speak to everybody tonight, and welcome everybody. My name is Özgü Özün. As Caroline mentioned, I'm the managing director of Dünya IVF in Northern Cyprus. And tonight we will speak about the IVF regulations in Northern Cyprus to help the potential patients understand in a simple way the rules here. So first, so tonight I'll be talking about the assisted reproduction techniques regulation in Northern Cyprus that was actually updated. It was last updated in June 2016. So that will be the basis of my presentation here tonight. And I just want to mention that obviously the regulations can change and be updated at any time. So tonight I will just try to basically summarize parts of this regulation to make it simple and understandable to you. Okay, so why has Northern Cyprus become such a popular destination for people traveling for IVF treatment from abroad? So I would say the number one is the favorable or liberal regulations that we have. So all those things that I will speak tonight with you. So all these liberal regulations have made the IVF sector quite advanced here. So I would say the clinics are at a very high standard with their technologies, and the know-how has grown significantly since let's say the IVF started in Northern Cyprus a little over 15 years ago. Most of the patients traveling to Northern Cyprus generally come for donation treatments. So the availability of multi-ethnic donors without a wait list is another big plus. Another advantage is that most of the nationalities in the world can come and visit us without the need for a visa, which is a big deal. We also have quite affordable prices over here. I would say the value that the patient gets for the cost that they have to incur is quite good. We're an island, and I think the warm attitude, warm relations that we have also pass on to the personal and friendly patient service that we give to the travelers. And last but not least, obviously Cyprus is quite a holiday island, so patients can combine their treatment with a holiday. In fact, our clinic is based in Kyrenia, which is the northern coast of Cyprus. And in fact, Kyrenia is a touristic town, and all the, let's say, popular beaches and five-star hotels are quite close to our clinic. So what does this IVF regulation cover? It actually covers, let's say, three main categories of things. One is the physical infrastructure of the clinic. So it talks about things like how the laboratories should be, how the examination rooms, how big they should be, what kind of equipment they should have. And also it even talks about, let's say, the air quality that must be available in the labs and operating theaters. Another category of things that this law talks about is the personnel. So it talks about the number of, let's say, nurses, doctors that the clinic must have, and the qualifications that they must have to be working here. And the third category of things that this regulation covers, obviously, are the treatments and what's possible. So tonight, I'm not going to bore you with the first and the second one, so I'll concentrate on the treatments, things that are most interesting to you. So I'll start with those. So which treatments are allowed in Northern Cyprus? Quite a lot of things, actually. So IVF, where your own eggs and semen are used. So most countries in the world have this. So generally, patients undergo IVF treatment in their own country first before thinking of traveling abroad. So most of the time, the patients that we have for IVF are people from here, or they might have had several failed cases in their own countries, and then they think of coming here. But I would say the vast majority of patients traveling here are for donation treatments, and that's mainly for egg donation, where donor eggs are used. People travel also for sperm donation, where donor semen is used. Embryo donation is also allowed. That's double donation, basically, where both donor eggs and donor semen are used for the treatment. Surrogacy can be added on to these treatments under certain conditions. I'll talk about those later. And genetic screening on embryos can also be done. Lastly, oocyte, semen, and embryo cryopreservation can be done. Okay. So first of all, the general things that apply to all of the treatments. Patients do not have to be married. Women of advanced age can also be treated. There is no maximum age limit in the regulation. However, women over 45, so that's actually 46 and over. So if you're still 45, you don't need a permit. But 46 and over, you will need a permit. And later on in the presentation, I will speak about what those additional tests that you must do to be able to get that permit. Women over 45, in addition to the things that are needed for women over 45, you also need to come to visit our ethical committee, which happens here, if you are considered for further assessment. So I would say that typically women over 55 are not accepted, but there is this possibility for motivated, let's say, over 55-year-old women who want to have treatment to apply. But as I said, it's quite unlikely that women over 55 will be accepted, but again, it's possible. It may be possible. Single women is not a problem, can be done. And another question that we normally get is the number of embryos, how many embryos can be transferred. In the regulation, it basically says it depends on the age and the prognosis. So the maximum is 3, but if you're, let's say, a woman around 35 years old and it's your first time trying, then 1 is allowed. But if you're an older woman with repeated failures, then a maximum of 3 is allowed. Having said that, in our clinic, we recommend using only a single embryo transfer. Currently, the average number of embryos that we transfer in this clinic is around 1.6, 1.7 per cycle for all prognosis. Okay, starting off with egg donation. The egg donation in Northern Cyprus is anonymous, so the egg donors is not possible to reveal the identity. That's the way things are here. The regulations also dictate that the donor must be in the ages of 20 and 35. Again, here our clinic has a little bit more stringent rule here. We do not accept donors over 30 years of age. Egg donors must be having a BMI between 19 and 29. And they must have been physically and psychologically assessed by our medical team. The usual infectious disease testing is required. In addition, thalassemia testing is required in Northern Cyprus because obviously we are a Mediterranean country. This is a big deal here. And additionally, the karyotype testing is required to make sure all the chromosomes of the donor is normal. Sperm donation. Sperm donor must be between the ages of 20 and 45. Our regulation says that the donor semen must be from sperm banks. This could be anywhere in the world. Obviously, there are several that are quite popular in Europe, but it doesn't mean that we have to use only European sperm banks. The regulation also says that the physical characteristics must be known. Anyway, this is the case in all sperm banks. And karyotype must have been tested. In any case, most of the time, this is the case as well in sperm banks. And the typical infectious disease testing is required. I highlighted the thalassemia, HTLV-1/2, cystic fibrosis, and sickle cell here, because generally, these are the ones, even though most of the sperm banks test all these, and if not more, things on a sperm donor, these are the ones that are quite specific, and especially thalassemia. Thalassemia is a big deal in Northern Cyprus, so patients should pay attention. If they're bringing their own donor semen from abroad, then they should choose a donor that has been tested with thalassemia. In some rare cases, there are some donor semen without thalassemia testing done, and then import to Northern Cyprus is not possible. In any case, we have a huge stock of semen in our laboratory from sperm banks, so generally we use those. Embryo donation is basically double donation, so it's the case where egg donation and sperm donation is used, so this is allowed here. It's generally called double donation in Western Europe. It should not be confused with embryo adoption. Embryo adoption is where a patient donates their surplus embryos that they do not want to use to other couples. There's no mention of this in the regulations, and we don't do this in our clinic. Okay, so egg, sperm, and embryo cryopreservation is also possible in Northern Cyprus. I think this is the case in most countries, but what's most interesting is oocyte freezing for social reasons is allowed. So this is a big deal for women who would like to preserve their fertility and use their own eggs later in life due to, let's say, career or other personal reasons. Of course, both oocytes and semen can be cryopreserved for medical reasons, and that's quite straightforward anyway. Embryos can also be frozen, and they can be also thawed, obviously, with both partner consent. So what's important to note here is that obviously after embryos are frozen, if let's say the couple separates, then it's not possible to use the embryos with only one of the partner's consent. It has to be both, because embryos are theirs, both, not only one person's. We can store embryos up to 15 years, as mentioned in the regulation. Okay, moving on to surrogacy. Surrogacy can basically be added on to any of the treatments that I mentioned earlier. However, it should be noted that it's only accepted for a medical reason. Generally, the guideline about what a medical reason is basically a lack of uterus or an anomaly in the uterus, or serious heart or kidney problems, or past, let's say, cancer history, breast cancer history, or previous history of HELLP syndrome. Surrogacy is for heterosexual couples only, but marriage is not required. Surrogacy would not be accepted by our authorities if a couple already has a child. So this is unfortunately, let's say, the detail here. Patients generally find their surrogates, and they're normally either family members or a surrogate from a surrogacy agency. Our clinic does not have surrogates. We do not arrange for surrogates. It's the patient that's finding their own surrogates. So the surrogates, according to the regulation, must be between 21 and 40 years old. And if the surrogate is married, consent from her partner is required. Another important point to note, currently in Northern Cyprus, if a woman giving birth is considered the mother, so in the birth certificate, it will be the person giving birth as the mother. Therefore, the birth must happen in another country where there's a favorable surrogacy law, where the person giving the birth will not automatically be the person on the birth certificate. So what's important is these are our regulations. So an embryo transfer can happen to a surrogate if it's meeting these requirements. But you should note that if, for example, you arrange a surrogate from a different country, from an agency, let's say, you must also comply with the regulations of that country. So let's say if that country requires you to have a marriage, then obviously then you will have to be married, even though it's not required in North Cyprus. So it's important to check the country where the surrogate is going to give birth. What are the rules there? For example, in Northern Cyprus, you can have surrogacy through egg donation as well, or sperm donation. But in some countries, this is not possible. So you must check. My advice is for you to carefully check, and if not, even get advice from a lawyer in your destination birth country for surrogacy. Okay, PGD, PGS, so genetic screening of embryos is allowed. Gender selection is also allowed for a medical reason. Typically, the patients that come here for genetic screening do have two main options. One is PGD, so day 3 biopsy is done on the embryos, and the results of the genetic test is released in a day or so, so you can have a fresh embryo transfer on day 5. Obviously, the advantage here is that the patient only comes to Northern Cyprus once, but the disadvantage is that only a limited number of chromosomes can be screened in this method. So things like Down syndrome, trisomy, and XY. If you want to complete check of all chromosomes, then what we recommend, in general what we recommend is actually PGS, so it's PGTA. It's a day 5 biopsy, but because it's a day 5 biopsy, then the embryos are frozen. The genetic test takes about 2 to 3 weeks for the results to be released, and that's why the patient has to travel 2 times basically and come back for embryo transfer about 2 months after the initial egg collection time. The main advantage here is that all chromosomes are checked, so this is a big advantage. Also, in less common cases, in very specific situations, if a couple has a single gene disorder that they don't want to pass on to their offspring, then we can also offer this to them. Okay, another, let's say, topic that a lot of our patients want to know more about is import and export of human tissue. So the regulation allows for semen, oocytes, or embryos to be sent or received from Northern Cyprus, but a permit is required for both directions. What's important here to know is we can receive or send human tissue to anywhere in the world. However, again, like surrogacy, you must check your destination country regulations, because if, for example, you have embryos here in Northern Cyprus that were created with donor eggs, but the destination country does not allow egg donation, then those embryos will not be allowed by the receiving country. So this is an important point. But generally, most of our patients are sending donor semen here or their embryos to here. So these are not issue. We can apply and get a permit. It usually takes 4 to 6 weeks, depending on how busy the authorities are. And then we can accept your human tissue, whatever it is that you want to bring here. Again, I want to highlight that semen donors, in addition to the usual tests, they must be tested for thalassemia, cystic fibrosis, HDLV1/2, and sickle cell. So this is something to pay attention to. And another important thing that patients ask about is, for example, if they have had treatment somewhere else in the world where they have, let's say, frozen embryos, and because of time, their age has passed. Let's say the regulation in the country where they're storing the embryos, the frozen embryo transfer age is, let's say, maximum 50, but they're now 52. So they won't be able to transfer their embryos in that country. Then we can apply to bring those embryos here, apply for a permit both for embryo import and both for over 45 permit, and then we can have your embryos coming to our clinic or Northern Cyprus, any other clinic, and then an embryo transfer can be done. So what are those additional things that are required from women over 45? Obviously, it's a bit of a long list. I'm not going to go one by one, but generally, what you should know is that you need a report from an internal medicine doctor and a cardiologist to say that basically you are fit for pregnancy. And we will also be asking for these blood tests and urine tests to make sure that you're safe for pregnancy. So if all these are fine, our authorities will give you the permit. So it's all about having, let's say, good results in these, and then you will have the permit. Yeah, another obviously current hot topic is COVID-19. So I wanted to touch on this as well. Currently, vaccinated travelers from countries with low incidence of the disease can basically come into Northern Cyprus quarantine-free. And only a very few countries can come in without quarantine that are not vaccinated, basically. The COVID situation in Northern Cyprus has been quite well managed from the beginning. I would say we had very low cases from the beginning, mainly because of the strict rules for entry here. Travelers, but let's say a month ago, things have opened up, so it's much easier to come now. But one great thing about our rules is that IVF travelers have a different rule. So I'll speak about this in a second. So the general rules is that basically if you need to quarantine, then you need to quarantine in a specific designated hotel or a rented apartment or a house with the use of an electronic bracelet. So they actually make sure that you are where you tell them. Quarantine period is 7, 10, or 14 days, depending on your country of residence. And there are some countries where there's a very unfavorable epidemiological situation where travel is not permitted from. Now, vast majority of the world, it's allowed to come here. And even if you have to quarantine, the great news is that IVF patients can actually visit the clinic during the quarantine period. So let's say you arrived here on a Monday, you can visit us on a Tuesday. But you must have done a PCR test before visiting us. If it's negative, then you're allowed to come from the quarantine hotel or apartment to visit us and back. You're not allowed to stop anywhere else, for example, a market. No, you have to go back to the quarantine facility. But the great news is that you don't need to stay an extra amount of time. So another great thing is that you can leave before your quarantine period is up. So if you are unlucky traveler from a country where 14 days of quarantine is required, but if you are done in 5 days or 6 days, which is typically the case for travelers to our clinic, then you can go back on the 7th day, let's say, even if that duration is 14 days. So you can end the quarantine early. Okay, and I mentioned earlier that most of the countries can come in visa-free. In fact, EU, Schengen countries and Turkish citizens can enter Northern Cyprus with just an ID, not even a passport is needed. Everybody else will need to have a passport that's valid minimum 6 months. Visa is only required for citizens of Syria, Nigeria, and Armenia. And Pakistan citizens residing in Pakistan also need a visa. But if they are not living in Pakistan, they don't need a visa. So that pretty much sums up the things that I wanted to say. And I just want to thank you again for being with us tonight. And yeah, that's actually the night view of our clinic. So that's pretty much how it looks like now. So thank you. And I'll also pop up my email address, actually, if anybody has a question for later. Here's my email address.
Thank you so much, Özgü. It's been definitely interesting. Lots of details, but also I think that I'm glad that you talked about COVID-19, of course, situation, how you handle it, and what the regulations are. Definitely interesting ones as well. To be honest, never seen anything like that, but it's good that patients are able to actually come, and even there is a quarantine, they can manage to go to the clinic. That was definitely something I noticed and I've never heard before. So great news, that's for sure. Yes, thank you so much. And yes, now we will start our Q&A session. Of course, there are some questions already, as you can see, but of course, if you have anything else, go ahead, type those in right now. But as Özgü has mentioned, if you wish to get some more details or just privately would like to speak to anyone from Dünya Clinic, and of course, here's the email address you can use, and I'm sure they will be happy to help you out as well. And let's have a look at the very first question we have from Anna. In regards to your presentation, yeah? So I don't know if I understood correctly. Do you have donor sperm banks from Cyprus? Can we bring non-anonymous donors from international banks and use it in Cyprus?
Yeah, okay, so I'll clarify this. There aren't any sperm banks in Cyprus. So the sperm that we have in our laboratory is from sperm banks from abroad. So they're, let's say, the ones that you know. So you're asking if non-anonymous donor can be used. Yes, of course, we can apply for any semen that you're interested in that fits the categories that I mentioned, and then we will apply to our authorities, and typically they would give a permit for this.
Perfect. Thank you so much, Anna, for your question and, of course, for your answer. Let's have a look. Now it makes perfect sense. And Anna has added one more question. What is the destiny of frozen embryos after those 15 years of storage?
Yeah, it's a good question. We haven't had a case like this yet. What I can tell you is, even though it says storage is for maximum 15 years, so you must have used it within 15 years. So let's say if you freeze in 2021, obviously you have to use them by 2036. We haven't had such a case yet, but what I can tell you is our authorities are quite patient friendly. So I think after the 15 years, we would actually make a one-off application and ask their opinion if we can transfer, if that many years have actually passed and you still want to use your embryos.
All right.
And we'll have to wait for their answer.
Yes, exactly. Thank you so much. Definitely interesting question.
Yes.
True. Okay, let's have a look. Okay, we have another question from Lisa this time. Are there any Asian donors? Are you able to inform what donors?
Yeah, Asian donors, basically, I would say Central Asian donors are possible. If the question is for Far Eastern, then I would say it's very rare, so the wait list would be quite long for that. But if the patient is happy with, let's say, a similar match, like a Central Asian donor, then yes, it's possible. And yeah, if the donor is happy to share that information, then we can say what's their nationality.
Excellent. So it's just about the donors, actually. Then they can decide whether they want to.
Yeah. And okay, I assume the question is for an egg donor. But if the question was for a sperm donor, then yeah, of course, there's quite a few different Asian countries that are represented in the sperm banks. So we can bring in any. We actually have in our stock as well.
Okay, perfect. Thank you so much. Definitely interesting to know. Okay, let's have a look. Joanne has added, can a fully vaccinated couple from the UK come to you without quarantine currently?
Yes, you can. Yes, you can. So that's great. UK is in an orange category, and countries in orange can come in to Northern Cyprus without quarantine if they are fully vaccinated. In fact, orange countries also Germany, Switzerland, Austria. So yes, they can.
Thank you for the clarification. And Lisa has added one more question. Can the child from the donor egg have the right to contact the donor at 18?
Unfortunately, no, because the egg donation program is anonymous, so this is not going to be possible.
All right, of course, thank you for the clarification. I'm just waiting. There are no questions at this point, but of course, if you have any left, you know what to do. Go ahead, type those in.
Yeah, sure.
And let's give it a second. If not, we will be finishing.
Yeah, sure. I would also advise our patients to have a look at our websites or the other clinics in Northern Cyprus. There's a lot of information there that will help them educate. And if there's any questions in their mind that's not answered tonight or through the websites, then please go ahead and send us a message, and then we'll be able to answer those with you.
Yeah, of course. As you have mentioned, the email address in the chat section, you can find it there, right? So sure. Don't hesitate. In the meantime, one more question is right here from Anna. What are the genetic tests you do to the donors?
Okay, the genetic tests, actually, the main one is the karyotyping. So that's where we check the chromosomes of the donors that everything is normal. If any other genetic test, let's say, is required by the patient, we can do more things depending on their genetic history, or if they want to, even if they don't have any genetic issue, they still want to have a bigger panel of things that they want to check on a donor, then we can add this on and we can do a test, like a CGT, for example, that looks at many things. But this is not required. So typically, only if it's us, then we do the CGT, but the main genetic thing that we check is the karyotype.
Excellent. Thank you so much indeed. And let's wait a bit and see if we have more questions. If not, we will be finishing, but someone is typing. I just want to wait and see. But in the meantime, if you can perhaps answer one of my questions, I'm always curious about this, especially recently. There are some countries like Greece, not Greece, sorry, other countries, where they are having anonymous donation, and for example, Spain, sorry, and there are some talks whether we should change to anonymous donation. Is there any talk like that in North Cyprus? What do you think is going? Is it possible that it might change?
No, there is no current discussion about this, and I don't expect it to change anytime in the near future about this. It seems that this is going to be like this for a long time.
Perfect. Thank you so much. I'm always curious. It's, of course, definitely interesting to know. Thank you for the clarification. Anna has added one more question. Let's have a look, okay? Okay, but if the patients ask for more genetic tests, who pays the costs?
Yeah, if it's an additional test that is not done as a standard, then, of course, would ask this from the patient. So the patient would pay for this genetic test.
Okay, thank you, Anna, for yet another interesting one for sure. And as you can see, there's a thanks as well.
You're welcome.
You. And I guess we will be finishing, but as always, remember it has been recorded. You will have a chance to watch this again. And of course, if you would like to share it with anyone who might be interested in this topic, you will be able to find it on my IVF Answers tomorrow and also on our YouTube channel. And again, if you would like to get some more details, you can contact Özgü, and I'm sure he'll be happy to help you out. And before we finish, any final comments, any final words you would like to say? Özgü, is there anything you would like to add?
Yeah, I just want to thank everybody. I mean, this is obviously difficult time for travel, but the great thing is, as I said, in Northern Cyprus, IVF patients have specific separate rules that make their life easier. And I can understand how difficult of a time it is. It's stressful enough journey for patients to travel abroad, but I can assure you that our team is experts in helping you along the way to make this as easy as possible, relatively speaking, for you.
Perfect. And you are running, the clinic is working 100%.
Yes.
People, patients are coming in, so all this...
Yes, we're pretty much back to normal, except these rules that I mentioned about COVID-19 travel. But yes, patients are coming and we're operating normally. Almost all our staff is vaccinated anyway, and we have to do PCR tests every week. This is also a part of the regulation because we're a clinic. And in any case, our patients are also doing PCR tests before they are coming. So we are relatively safe.
All right, that's definitely reassuring. And as you can see, one more thank you for all this information.
Sophia.
Thank you so much indeed. And once again, thank you. And of course, remember that if you go to our YouTube, there are over 360 IVF webinars already. So there are plenty of topics that you can have a look at. And if you subscribed, of course, you will be notified that the video has been uploaded. I can only encourage you to join us tomorrow. We will be back at 8 p.m. UK time, and we will talk about legislation in Ukraine this time. And thank you, Özgü, once again. Wonderful to have you indeed. And I do hope that we will have some more webinars in the near future as well with you. So thank you so much. Have a lovely evening, everyone, and see you soon. Bye.
Bye. Good evening.